Bacterial meningitis is an infection of the meninges, the protective layer that surrounds the brain and spinal cord. It is caused by an infection with certain types of bacteria, like Neisseria meningitidis. Generally, the bacteria enter the body through the nose and throat, and spread to the meninges. Symptoms may include a fever, headache, stiff neck, confusion, and neurological deficits. The diagnosis of the condition is based on meningeal signs, blood tests, and imaging. Treatment involves antibiotics and supportive care, such as oxygen therapy. In severe cases, surgery may be necessary to reduce the pressure in the brain. Complications may include cerebral vascular accidents, hydrocephalus, and hearing loss. Vaccines are available to protect against certain types of meningitis. It is important to be aware of the signs and symptoms of bacterial meningitis and to get prompt treatment if symptoms develop. Meningitis is a potentially life-threatening condition, so early diagnosis and treatment are important. To reduce the risk of bacterial meningitis, it is important to practice good hand hygiene, get vaccinated, and avoid contact with individuals who have the infection. Bacterial meningitis is more common in newborns and young children, although it can affect adults. It is also more common in areas where overcrowding and inadequate hygiene are a problem. Meningitis can be spread through contaminated food and water, coughing and sneezing, and close contact. There are also certain medical conditions that increase the risk of bacterial meningitis, such as head trauma and certain congenital defects. It is important to seek medical attention right away if a person has any of the symptoms of bacterial meningitis. Early diagnosis is key to successful treatment and prevention of complications. Bacterial infections are generally easily treated with antibiotics. Treatment must be started as soon as possible to prevent further damage. Diagnosis and treatment require specialized care from a neurosurgeon or infectious disease specialist. Additionally, a supporting team of healthcare professionals may be needed, such as nurses, physiotherapists, and psychologists. Depending on the severity of the infection, long-term care may be needed. It is important to seek follow-up care to ensure that any complications are managed properly. Antibiotics may need to be continued for several months after the initial infection.